Good morning, ma'am. So my name is Jessa Domingo, your nurse for today. And today I am going to assess your chest and lungs. But before that, may I know your name, ma'am? Your age? Where is your address, ma'am? Okay. Well, before we start, let me just close the door and the windows for your privacy. So first, we're going to perform the inspection. So I want you, ma'am, to look at me straight and breathe normally. Okay, so for the chest is symmetrical. There is no logging or delays, and there is no deformities as well. And now I am going to assess the chest diameter. Okay, so the chest lateral diameter is greater than AP diameter, which means normal. And now I am going to check if there are abnormal retraction in the muscle. So let's start with the sternocleidomastoid. So for the sternocleidomastoid, there is no abnormal retraction in the normal retraction noted. When for the muscle intercostal, here, there is no abnormal retraction noted. So let's proceed to the auscultation. So let's start with the anterior of the chest. So may I ask a few questions, ma'am? Lately, did you experience cough or difficulties of breathing? Okay. Do you feel any pain of your chest? Okay. So let's use the diaphragm of the stethoscope in auscultating the chest of the patient. So starting here in the Okay, so let's go on to the posterior area. So for the posterior area of the patient, starting here in the line. Okay. So for the breathing sounds, there is no abnormal breathing sounds. There is no whistling, bronchia or crackles. So there so she has normal breathing sounds. Let's proceed to the palpation. Now I am going to palpate your anterior chest. Do you feel any pain? Okay. For the anterior chest, there is no tenderness, no masses, and sinus tract noted. So let's go to the posterior area. Do you feel any pain? Okay. So for the posterior chest, there is no tenderness, masses, or sinus tract noted. And now I am going to check your chest expansion. I am going to place my thumb in the costal margin so you can feel a little bit ticklish feeling. So I want you to inhale and exhale. Okay. So let's go to your posterior area and put my thumb in the T10 area. Okay, so I want you to inhale and exhale. Okay. So for the posterior portion, for the chest expansion, there is no lagging or delays. It is symmetrical, so it is normal. And I am going to check your tactile primitus. So I am going to place my hand in different parts of your chest, and I want you to say 99. Say. And for your posterior, again, say 99. Okay. So the tactile primitus is normal. Let's proceed to percussion. I am going to put my proximeter finger on the intercostal space, starting on the supraclavicular space. So let's move on to the posterior area. So percussion, it is resonant, there is no dullness and dullness noted. For summarize, first inspect the chest and lungs of the patient. So for inspection of the chest, there is no abnormalities that was noted. For the palpation, as for the chest expansion as well as the tactile primitus, it is normal. For the percussion, it is resonant, no dullness, and for the auscultation, there is no abnormalities of breathing. That's all. Thank you.